Namaskara. I am Dr.Harihara Murthy. I am an ENT specialist and head and neck surgeon. I also do treatment for snoring and sleep-related breathing disorders. I practice in Bangalore for the past 3 decades. Snoring is at best a social issue where it disturbs the people in the vicinity of the person who is snoring. It is not a major life-threatening problem, but it could be a camouflage of a more sinister problem of sleep apnea, wherein there is a stoppage of breathing during the course of the sleep. That is more of a serious issue and requires to be treated. Having said that, snoring itself can be caused by multiple reasons. One of the most common problems that have snoring as the effects of it is hypothyroidism. Many people who are hypothyroid tend to have a lot of waterlogging of tissues and a laxity of tissues, as a result of which there is a reduction in airspace and they have noisy breathing, which is seen as snoring during sleep. That is purely a problem that can be treated with medication. But there are times when the air passages starting from the level of the nose to the palate or deeper down in the throat can cause snoring. If that is the case, one has to identify the causative factors of snoring. If there is an obstruction, find out what is the level of the obstruction and accordingly treat that. Once the obstruction is relieved and free flow of air is effected during sleep, there is less resistance, and as a result of which snoring can reduce. Apart from that, we also do tightening procedures to reduce the snoring at the level of the palate, oropharynx, base tongue, etc. There are many ways that snoring can be treated surgically and medically, but then we need to actually customize the treatment for that particular person, and that is why we need to have a multi-speciality evaluation, be it the oromaxillofacial surgeon, ENT, the pulmonologist, etc. Unless we identify the different causes for snoring, we will not be able to effectively treat it.